The activity card sort is a flexible and useful measure of occupation. The activity card sort allows occupational therapy practitioners to help clients describe their instrumental, leisure, and social activities. The format, which are photographs of individuals performing activities, is non-threatening and easily understood. The information obtained by administering the activity card sort will provide clinicians with an occupational history and the information to help clients build routines of activities that are meaningful and healthful. The activity card sort consists of 89 photographs depicting activities that fall into 4 categories. The 4 categories are: number 1, instrumental activities, those necessary to maintain self and property. Number 2, leisure activities that do not demand high physical strength or endurance. Number 3, leisure activities that require physical endurance. And number 4, social activities. Some of the highlights of the activity card sort includes that it captures differences in activity patterns that have clinical usefulness. It gives the OT an immediate impression of a client's activity to use in treatment planning. It allows the practitioner to see the impact of a disability on a client's activity pattern by appraising pre- and post-accident or illness performance. It fosters the use of treatment activities that are meaningful to the client. It helps the practitioner work with family members and friends to enable activity and social participation. It provides the practitioner with useful information to share with colleagues that is consistent with an occupational approach, and it is a sensitive tool for research purposes. So, one way that you can administer the test is to place the 2 labels "done prior to illness or injury or admission," or "not done prior to illness, injury, or admission," on a flat and uncluttered surface in a position that the client can see. You ask the client to look at each of the activity cards one at a time and place each card under the appropriate label according to whether he or she did the activity before coming to the hospital or nursing home. The directions are: please place each picture in the category "done prior to illness, injury, or admission," or "not done prior to illness or injury or admission." After the client has sorted the cards, ask him or her or them to select the 5 cards that depict the activities they regard as most important. If a caregiver has helped with the card sort, ask which activities are most important to their loved one. List the 5 activities that the client deems most important on the last page of the scoring form. And then the directions are to please tell me from all of the cards you have seen, what are the activities that are your or your loved one's favorites? Please name 5 activities. They may be activities that you have or your loved one has given up. Then you record the responses on the worksheet. The worksheets are all presented in the CD-ROM that comes with the assessment tool. The form of the ACS, or the activity card sort, quickly provides an occupational history that can be recorded in the client's medical record to acquaint the team members of the client's activities and capacity before the current illness or injury. When placed in the medical record, it also establishes the client's prior level of function, which is a pretty critical component of the occupational history and can be helpful in setting targets for discharge and length of stay.